the maxillary.
Actually, she had a clip for some time.
Yeah,
okay, you had braces for a while.
When she was non-compliant, she removed it.
Yeah, in between I had removed
and
it.
it was reapplied.
Okay.
And she completed 19, sir, now.
Okay, you're 20.
Yeah, and I met a doctor in Coimbatore and he suggested maxillary advancement because my maxilla was a little inside and Rhinoplasty reduction a little bit.
Okay.
So,
Yeah, I think his suggestion seems to be on track. Maybe not reduction, but advancement for sure. Yeah, because reduction generally, you know, makes your face look a little older, but advancement will take care of all of that. Okay, open your mouth nicely. 2 premolars. Okay. And then bite. I think it's better you do the advancement, doctor, first, and then complete it with braces. Because you know what will happen, show me this, there is some lack of space in the upper jaw, which is actually causing these teeth to come out. So, which means if you bring it forward, then you have space to retract a tooth, if need be. So we could remove this, the orthodontist will decide, but to reduce space is easy by dental. They can't increase the space in the arch. So if you bring it forward, what will actually happen is, so this relation is correct, but this is all inside. So when the upper jaw comes forward, this will go off, the nose will get a little narrow, and it'll make a better improvement to the facial proportions and aesthetics also. Plus, she will be able to get a better bite. With this scenario, you cannot get a good bite. They will not be able to give you good bite no matter what they do. They will tell 1 more year, 2 more year, they'll do circus, but it will not work out well because it's obvious. So whether you want to do genioplasty, that is, I don't think it's a mandatory thing, because setting back doesn't look nice. It will make some loose skin here and it's not a good procedure. But advancement we should do. Finish with the litho one, like a high osteotomy, bring it forward, fix it, and then after about 2 months start the braces. Initially the bite won't be very good for you. So first few weeks, first few months, chewing will be a problem, because you know the new position is not going to be as good as this, it's going to be worse than this. Then when they retract the teeth and align with the braces, eventually it will be better. Both the facial aesthetics and also the bite, without which you cannot achieve that. So it's very straightforward. Yeah.
It's going to be a major surgery?
No, doctor, not major and all. No, no. We keep doing so many like regularly. I don't think it.
She's the only child for us. She's the only child for us. So we are very afraid for surgery.
Well, see, I have one suggestion. Yes. She's already pretty, and if you think you don't want surgery, don't do anything. Yes. But do not go out with braces. Yes. That's an option.
I want to do the surgery, they are opposing it.
Oh no, this is something that you people decide, only child. So, you know, it's not a mandatory thing. It's not a must.
I told her she doesn't have a cleft lip or a cleft palate.
No, no. Madam, those days are gone. You're an Instagram era now, you know.
Not having a squint also.
Instagram era, you will be surprised the patients I do here. I can't tell you the in words. If I tell them no also, they'll not go. One guy is waiting there for 2 days. मैं surgery के बिना जाऊंगा नहीं. They'll make strike. No, it's very difficult. You can't say like that now, today's era. You have to just make them understand and buy some ears or something like
So
that.
getting a guy for her at 25, 25 years is not
That's
Sorry,
going
sorry,
to
sorry.
be this personal. We will get a guy for her.
That's not
Well, guys, you will get for anyone.
This is enough.
Yeah, ma'am,
This is enough.
but that is something that even I feel. But if my son who is in 12th standard wants something, I find it difficult to convince him. So this is something I can tell you easily. It doesn't happen in my own house, so I don't know how to say that. Yeah, see, what are you doing now? Medicine?
She's just applied NITS. She's waiting for the second round counseling.
So it doesn't have to be done in a hurry, right? It can wait. So now you get an idea. wait over it for a 6 months or 1 year or something. By the time you also start med school, you'll know, and then after that you can decide and go ahead. What happens is usually when students especially are doing medicine, other things, you know, I'll tell you the functional aspect for this now. So what tends to happen, she's 20 now, she may not snore or she will not have any breathing issue. But maxillary hyperplasia means the less growth of the upper jaw, which is the diagnosis for her, means that the hypopharyngeal airway is less, means the airway behind is less, the space is less. This is not good for two things. It is not good for sleeping because the tongue goes back, snoring chances higher. Also that is related to apnea. So if they develop sleep apnea, in the long run it can affect the vascularity of the brain, and all these things are related. Today's medicine, we know this. So functionally also, this is not something that you will think is just cosmetic. I will not brand it as a purely cosmetic surgery, because in today's, if you do little research, I work in Stanford also, the sleep studies there, they very clearly even said life expectancy affects directly now, because they tend to get hypertension, then they get other issues because of this. It was not well documented years ago. Even when I finished my training 20 years ago, it was not so well documented, but today it is. So that is another aspect you have to look at with maxillary hyperplasia. So it's definitely not something that when you are in the medical field and when you are doing there, see, the risks are very little, ma'am, to be very honest. There's no risk for surgery. It's less risk than you coming from now Coimbatore, right, to here. That is a fact. What is the risk? Risk is some infection, those kind of things. He's a surgeon. Less risk than that because she's young.
He's a nephrologist.
Okay, so it doesn't operate. Okay, sorry. But whatever. Risks are related to surgery only. You don't have to expect nose getting botched or jaw. It's not going to happen. If the improvement is not 100%, you can expect 90% for sure. So there's still going to be an improvement.
Wiring and other things.
No, doctor, no wiring will be there. Directly.
I'm sorry,
No,
can you
implants
explain?
also will be there.
Yeah, plates and screws will be there
Can
inside.
you please
Yeah.
That will be permanent, sir. That
Permanent. If you want, you can take it out after 6 months. That's not a big deal. We can remove the implants after a few months and throw it away.
How to go with surgery?
Can you explain the surgery?
So surgery is, we make a cut inside and then go to the upper jaw and make a cut on the upper jaw bone, which will be pretty much like at this height. Your nerve will come, then infraorbital nerve beneath that like this. And then the entire jaw will be made free from the pterygoid plate, which is attached to the upper jaw, and moved forward, along with the muscles of the hard palate and the teeth, base of the nose, the piriform rim, anterior nasal spine, everything will come forward. This is roughly said. And then at that position, we fix it with plates and screws. Now, how many millimeters we need to bring forward? I need to see, not lateral cephalogram anymore. We have to take scans. Only when you decide for surgery, I need it for surgical purpose. We need to take the CTs. I'll show you some other patients maybe if you want how it goes. And then we measure with some dental cast and everything. And then we say, okay, we need 6 millimeters for you, or we need 8 millimeters for you. It's going to be between 5 to 8, not more. That's it. That much millimeter, we will do what is called as a mock surgery. Mock surgery as in the surgery is first done on casts. Either we can make like this. These are models which you can make with CAD/CAM and do surgery on these. Or we can also make our own casts here, articulate it like upper and lower jaw, cut on that, move it forward based on the scan and calculation, fix it there, make a wafer. It's a splint. That wafer will go with us for surgery as a guide. Then I will be intubating here, so it's not going to be oral or nasal because I want the face to be open. I'll tell you why I do that. It's because I want to make sure the nose is also perfect. So because what happens when you move, I said the piriform rim and the anterior nasal spine moves. So unless you do some work on the nose, sorry madam? Not tracheostomy. So we make a small incision here which is not visible and put, it's called transmyeloid intubation. You can check on our YouTube channels.
Yeah, I've seen.
Yeah. So that's, I do that. It's not tracheostomy. We just here, nothing will be there. No scar will be visible, nothing. It will be closed at that time. But because I put it here, the whole face will be open and it will give me opportunity to work on the nose. I can't put oral intubation because I have to correct the bite. I need the wafer that will sit between the teeth. And then if I put the anesthesia to the nose, I can't work on the nose. But I need to see the nose because we're bringing it forward. That's what I do, which most of the surgeons don't do. Because the nasal work is very necessary in order to make sure the nose doesn't get spoiled, on the contrary gets better. So why? Because it's all interrelated. The septum exactly attaches on the crest from the antenasal spine till the back. So you detach it fully. So when you reattach it, you got to make sure it's in the right position. Then the width of the nose, the tip, all of those little changes we can do. So that will be the process. After that you stay for maybe 3 days. Since you're a doctor, you can go after 2 days also. Then just some IV antibiotics, whatever. That's it. It's good.
How long would the timing, sir?
Surgery is probably going to take me a couple of hours.
And the recovery? After surgery, recovery after surgery.
So you will be in the hospital. Normally people come from far, non-doctors we keep for 5 days for a one job procedure like yours. You can go after 2-3 days if you want. It's not a big deal. Get some IV antibiotics, some painkillers. Total recovery as in somebody else doesn't know has been done with your face will be 1 month. But for you to feel like how you feel now will be 6 months. It takes a while because the bone has to heal and then there's a gap in some areas, so some fibrous healing happens.
No non-veg for 6 months.
No, you can eat. Fish you can eat even day 1 because it's soft. You shouldn't eat anything hard or chew. But if it's soft, you can eat crab meat. You can eat anything that's soft, but not like bones. So you got a good picture of everything. Appa doubts la irukadu. Avukku doubt illa surgery vendam. Adu doubt illa. Adu na doubt. Right? So doctor, I'll keep your card here.
Yes, sir.
Did you call our how did you come here, just directly?
No, so actually through one representative I got a appointment.
Okay, fine.
10 days ago.
Because I have told my staff to give contact numbers of doctors who call me. They usually give my personal number.
Okay.
Then I talk, but they didn't give me your number.
Yes.
They gave me this card now.
Yes.
So I wasn't sure what. So I was like, so let me write this down. Yeah, I'll give you my number. मेरा एक कार्ड लेके आना यहाँ पे है क्या?